to another fun week of Thrive Live. And today we are going to talk all about poop, which is very exciting, even for the adults, not just the 5-year-olds. It feeds maybe our inner 5-year-old. So let's first talk about why is poop so important? So digestion is one of the key foundations for the body. It is the starting block from where we can build health, literally from the inside out. And the reason why is, let's talk about just a couple of the things that the gut does. There's so much that a gut does. So we all know food is medicine. This is where we get our nutrients. This is where we get the nutrients for our immune system, for our cells, for our hormones. But that's only if you can break the food down into the nutrients that then you can absorb through the intestinal wall and then integrate those into the cells and the tissue. But if your gut has a whole bunch of inflammation in it, or you're not breaking down your nutrients, then your food becomes more of a toxin than actually of a nutrient. So from the basics, we got to be able to assimilate the nutrients in our food. That's the gut. Second point is the immune system. So 70% of the immune system resides in the intestines. That's huge. And the reason for this is because this is one of the areas where our immune system determines food versus threat. So when we eat a carrot, our immune system has to determine, is the carrot food or is it a virus and microbe and I have to attack it? So, and when we say threat, it can be a virus, a microbe, an infection, a parasite. So there is a big amount of immune priming that happens in the gut, which is why, especially for our autoimmune disease issues, our eczemas, those inflammatory skin issues, overall inflammation that's irritating the brain and creating insomnia, stress, a lot of it can go out of the gut. And so that's why another reason why gut is foundational. Now let's talk about serotonin. So the bacteria in our gut are the ones that are actually responsible for producing the serotonin. And 95% of total body serotonin is produced in the gut by those bacteria. And so if you have imbalanced bacteria, you have SIBO, you're going to get altered levels of that serotonin throughout the body, affecting anxiety, depression, ADHD, mood imbalance. And so it's actually the bacteria that is actually doing the serotonin, which I think is the cool fact about that one. Estrogens, talk about the hormones. So imbalanced gut flora, or when you have what we, quote, the bad gut bugs, when you have those in the gut, they overproduce an enzyme called beta-glucuronidase, which actually recycles the estrogen back into the body. So you end up becoming more estrogen dominant in your hormonal balance. I mean, the hormones are all about balance. So we'll see that not even just with the SIBO cases, just imbalance in the gut flora. So a lot of hormone balancing, we got to start in the gut. Now, there's just the overall flora of the gut. It's not just bacteria. We have viruses, microbes, parasites in there. I kind of think that in the next 20 years in medicine, we're going to figure out, well, we know we're supposed to have certain parasites in there, certain viruses. It's a dynamic ecosystem. And kind of the big joke is our existence on this earth is to carry around all the microbes in our digestion. We are way outnumbered with the amount of microbes in our gut. From a physiological standpoint, that's kind of the purpose of our existence, is to carry around the gut bugs per se. So let's dig into understand when I talk about digestion, what I actually mean. I'm going to attempt to do a screen share here. Let's see. Oh, nope, hold on. We'll just do it this way. If I put it into actual slide view, then I'll lose control over, well, we'll try it. Let's see what happens. Because it'll get bigger for you guys. Robin, thumbs up. Can you, does that look better? Okay. Only issue is I can't see my notes. Okay. So when we talk about digestion, we're talking mouth all the way down to butt. So your step one of digestion literally starts in the mouth, then we'll move down through the esophagus, then we'll move into the stomach, which is, I don't have my mouse, so I can't circle it. So then we'll move into the stomach, where you're going to be releasing your stomach acid, which is highly acidic. It's breaking down those proteins. And then that will move into start dumping into the small intestine. And so right at the where your stomach releases that bolus of food, that is where the gallbladder, the pancreas, they have their little tracks, and they are dumping their digestive juices in right there as well. And then you get into your hundreds of feet of small intestine, and then it goes into the large intestine and all the way to the butt. So we are talking the entire tube. Hold on, I'm going to stop sharing because I'm losing all control of my computer. Okay, so the intestinal, here we go. Hold on, so I'm going to share in a different form that's going to get me to the other slides, and I can still see all my talking notes. Let's do share that. Okay. So in the intestinal barrier, so this is inside the small intestine, we get these finger-like projections, we call them villi. And this picture with the purple fingers, that's literally what they look like. And a healthy gut is going to have these long finger-like projections when we're looking at celiac disease or chronic inflammation. We see that damage that barrier. And then in a really bad case, those finger-like projections are gone. And so all up and down these finger-like projections are actually your lock and key mechanisms to absorb your nutrients and to assimilate your nutrients out of the food. So just an interesting histology perspective of what happens to the gut with chronic inflammations, you actually destroy these finger-like projections and they go away. You can repair them by addressing the thing that's irritating it. So this is a big, deeper picture of the cells with those little finger-like projections kind of right on top. Sitting on top of this is a mucus layer. Think about it as the internal snot to your gut. This is really important because you need a healthy snot layer for the healthy bacteria to be in there. What we will see is that if we have imbalanced gut flora, if we have yeast in the flora, if you have Lyme disease, mold, et cetera, you're going to get a sick snot barrier. And so we want to help create a healthy snot barrier. And then once you just go a little bit deeper, you have your finger-like projections. And then let me kind of explain this picture a little bit. So you have all of your gut cells sitting together and they're kind of in a lock and key. Now, if there's overt inflammation, we start to see they loosen. You get a leaky tight junction, and it's also commonly known as like leaky gut per se. So what's going to damage that, make these cells pull apart, is going to be chronic food irritations, infections. We will also see imbalance in the gut flora, so like an intense SIBO case. So anything that is going to be irritating and damaging that gut barrier will allow those cells to pull apart. And then you're allowing food particles to pass through, viruses, whole viral particles are going to be passing through, bacteria, et cetera. So you get a much sicker gut that kind of feeds that cycle forward. So when we actually talk about a true leaky gut, that's actually what happens. Now, I have seen a lot of leaky guts per se and done a couple of testing. I don't even really test for it anymore because even on the cases that had all of the clinical symptoms, the tests were all coming out negative. So it's kind of like, well, what's the point of testing? Because we know that it's there based on the symptomatology. And so when you have a leaky gut, what does it mean clinically when we see that? It increases your inflammation. So fatigue, brain fog, achiness, trouble sleeping, moods, so higher anxiety, depression, OCD, thyroid irritation, adrenal stress. So it just kind of feeds that inflammatory process forward. Now let's talk about the poop. All right. So this is the Bristol stool chart. Type 1 is going to be your little pellets. Type 2 is kind of like your little pellets clumped together. So really dry, lumpy sausage looking like. So type 1 and 2 are going to be your constipations. And then type 3 and 4 are going to be, we think of them more as our normal. 4 is going to be more the smooth, snake-like, soft log. And then 5, 6, and 7 are going to be more of your progressive forms of diarrhea. Now, ideally, we kind of want to stay in the 3 and 4. So there's always going to be a fluctuation between softer stool, more condensed stool. It's going to be varied based upon how much water and your hydration status for the day. How much fiber did you eat? And then, of course, your stool is going to be based on, well, do you have SIBO or dysbiosis in the gut, which is the imbalance in the gut flora? Do you, are you having a viral infection or chronic food irritant? So there's a lot that goes into what determines the type of the stool, but so you know what to actually look for a healthy stool. There's always going to be a fluctuation between the different types, but we want to try and aim for type 3 or 4. So more of that sausage, we want it to be soft, sausage, brown. We don't want it to hurt. We don't want to be a hyper wiper, meaning you want to basically not have to use much toilet paper. If you're having to use a lot, then there's mucus and your stool is sticky, hence the hyper wiper term. So we want to try and not be hyper wipers. And so that's just another clinical indication that we need to address the stomach and intestines. I found this very entertaining. Healthline had some awesome images. And so I thought this was entertaining. So the normals, we're going for the hot dog or the snake. Constipation is going to be your Marlboros and your caterpillar look. And then your more diarrhea is going to be your amoebas, your soft serve, and your Jackson Pollock style. I thought that was quite hilarious. They also have a great one on the color too. So let's talk about what the different colors mean. So black stool is going typically, more often than not, it's from iron supplements, bismuth medication, licorice. Our concern, our red flag with if the stool is a black, sticky, tarry stool, because that can indicate bleeding in the upper intestinal tract. Very rare that I've seen it only a couple times, but that's the red flag for black stool. Most of the time, it's not that sticky, tarry look. It's more of just maybe a darkening from licorice or iron or the bismuth meds. Green. So green will be if you're eating a lot of green foods, or also if your stool is passing through your intestines too quickly. So a quick transit time. And as it passes through quickly, it doesn't pick up that brown tinting from the bilirubin, and it's in the bile salts. And so that's why the bilirubin gives that brown color to it. And so because the stool's moving, the intestines motility is too quick, so it's not able to grab those. Pale white or clay colored is going to just think gallbladder, because again, remember the bile is giving that color. And so you're not getting any of that bile into the stool, or very minimal. So you are basically not getting any color into the stool. This can be a side effect of some medications, but most of the time you're having liver, gallbladder issues, and it's not allowing that bile to dump into the intestines. Red always scares everyone. That's usually not this from the medical side. The scary one is that black tarry stool. Red, the number one, and usually the causes for that is beets. Beets is actually a way you can test your transit time. Eat beets, then see how many hours until you get red stool. Cranberries will do it, tomato juice, red gelatin, but beets is the very apparent one. I mean, your stool is bright beet red. If the red is just on the outside, or like blood just on the outside, then that's hemorrhoids, right? So as the stool passed through, then it broke open the hemorrhoids and has that bleeding on the exterior. And then yellow. Yellow is another alert color on the medical side, because this is meaning malabsorption. So we're talking prolonged like celiac disease. It can be, if you've ever had food poisoning and a traveler's diarrhea, you probably got to the yellow stool within 24 hours or 12 hours of having that, because right, you're not absorbing anything. And it's usually greasy, stinky yellow because it's way too much fat. And so it could be an indication of having gallbladder liver issues, but usually this is more of, we want to think of malabsorption. So the perfect poop, let's go back to the perfect poop again. So type 3 or 4, so sausage versus, kind of like that soft sausage or snake. It's brown, it sinks, you're not seeing an oil slick on top. If you see an oil slick, you're not absorbing your fats. And if you don't absorb your fats, you're not getting your fat soluble vitamins. You might be taking them as a pill, but you're clearly pooping them out, and pooping your money out as well. And so of course your fat solubles are going to be vitamin D, vitamin A, vitamin E. We only really want to be sitting on the toilet for about a 5-minute poop, I would say, is probably ideal. You don't need to be rushing there, but by the time you get to the toilet, you want to go and be done. It shouldn't be a 30-minute sitting on the throne. Comfortable, easy to pass, and not using a lot of TP. So let's talk about some basics to improve. I'll stop sharing so you can see me again. Some basics to improve poop. So number one is, remember, your poop is trying to tell you something about your body and about your insides. So go and try and find the root cause. Number two is abdominal castor oil packs. I love them. They see them as a facilitator to healing digestion. They're oily, messy, not romantic, but they are a fantastic facilitator for healing. The side effects is it will increase motility in the intestines, and it will also increase the liver detox. It will move the bile. So if you're already having fast motility, it's not necessarily, it can be helpful, but you gotta be super cautious. And we're talking about doing castor oil topically, not drinking it orally. And castor oil is one of those things, just as a side note, you can do it anywhere in the body where you want to increase blood flow, move out lymphatics. So if you sprain your ankle, you can wrap your ankle in it. If you blow out your knee, I've had patients do it with lungs for chronic bronchitis. It's a facilitator, right? It's moving in blood flow, oxygenation, nutrients, getting your lymphatics. It's moving your lymphatics. So it's a tool. Number 3, everyone forgets this: chew your food really, really well. Take time to chew your food. If you are swallowing your food whole, you are not chewing it. Chew until you basically it's kind of like a gooey texture in your mouth, then you can actually swallow. But if you're swallowing your food whole, then now your stomach, your small intestine has to handle that, and that's going to hurt your stomach. It's going to cause bloating, gas, is irritation to the whole stomach lining. So don't forget to chew your food. Other one is to sit down when you eat. Stop eating on the run. Stop eating in front of the computer. Digestion is a parasympathetic response in the body. So that is our relaxation response. So if you're eating on the run and on the rush, you've already shut down your digestive enzymes. Because think about it this way. And on a nervous system response, the fight nervous system response, if you're trying to run away from a tiger that wants to eat you, you don't want to be spending energy trying to digest your lunch. You want to spend energy into pumping your heart, your muscles, being able to run. Your immune system actually kicks up because you need to be able to fight any infections if the tiger bites you. So if we're not relaxed when we're eating, we've already put our digestion at a deficit because we've just shut down all of our digestive markers: stomach acid, gallbladder, pancreatic markers. So of course you're not going to feel very good. And I'll be honest, I am guilty of eating in front of the my computer when I'm working. So I am even guilty of that. So it's just reminders to keep working at it. Probiotics, yay or nay. It really depends on what's going on in your gut and in your intestines. I would say there is not one perfect probiotic for everyone. And yes, for those who know me, I love the soil-based probiotics because they expand the ecology and the biodiversity. And we know a healthy gut is a diverse gut, but not everyone is ready to handle that intensive of a probiotic. So let me explain soil versus non. So soil is the bacteria found in the soil. They're in a spore form. Some companies are better at keeping it in spore form than others. And they expand that biodiversity. They improve the digestive ecology. So when it comes to fixing the gut, it's not just about bacteria. It's equivalent to farming. The ecology has to be right. The soil has to be healthy. We have to water it correctly. We have to put in the right nutrients. So to truly fix the gut, we have to address the ecology. And then the soil-based guys also, those are the probiotics that actually colonize the flora, versus the non-soil based is almost everything sold over the counter. That's your bifidos, lactobacilli, et cetera. These are all transient and they'll pass through the digestive tract relatively quickly, and these do not colonize the gut. So there's definitely a time and place for the non-colonizers, especially when patients can't handle the soil-based colonizers, because that's a pretty aggressive probiotic. So let me open it up to questions. I think my 5-year-old actually probably wanted to give this talk. He goes to the bathroom and he sings. And he tells all of us to come and see his poop. So
that was funny. That was funny. On the castor oil packs, how much do you recommend using?
Great question. So what I'm doing now, because I've had more gut sensitive patients recently, is recommending, so you want to cover boobs to hips and start with 30 minutes and do like 30 minutes, 3 days in a row, 7 days off, 3 days in a row, 7 days off. But if you do great with it, you can sleep with it. You just have to be a little creative on wrapping it around, stabilizing it with an ace bandage, because castor oil will get into the sheets and everything, it won't come out. The longer you have castor oil on the body, the deeper the effects are. So you will have more intestinal motility, more liver detox, more movement of the bile. Now there was a research study done at my alma mater medical school where they showed that cycle of 3 days on, a week off, 3 days on, a week off was just as effective as doing it basically every day. So I'd say that 3 days on, a week off is a good starting point. And then you adjust there based on how you feel. Some patients do it more often because they feel better when they do it more often, and other patients do it less often because maybe they already have a quicker motility in the intestines, or it's a little bit too much on the liver and gallbladder for them. So that's kind of a good starting point.
Thanks.
Yeah. And I've also had, and speaking of that, for those of you who still have your periods, usually want to skip when you're on your period because it will increase the blood flow. Now, I have had castor oil packs actually improve the menstrual cramps. So it's always worth a shot if you want to give it a shot. Just know you're going to have a heavier bleed because castor oil is doing exactly what it's designed to do. It is mobilizing the blood flow. So, so there's that, and don't do it if you're pregnant, unless you are very well skilled in doing castor oil packs.
Does just rubbing it on your skin without the pack, does that do anything?
It does. It's not going to be as effective as the pack, because the pack, you're going to get a deeper oil concentration that's just sitting on the skin. So you'll get that more concentrated, but that is also kind of the cheater's way. Is you can just buy, I believe, castor oil in a roll-on stick, and you just kind of roll it on or just massage it in and put an old t-shirt on. You could definitely do that. You just won't get as penetrating effects. So it's like a mild version of the pack. Okay. I do have a colleague who has designed a pack, and she sells it online, where it's shaped more to fit for your abdomen, and it has strings that'll come around. You can tie it. Dr. Maricel, Queen of the Thrones. Actually, Queen of Thrones. HBO did not allow her to have Queen of the Thrones for her name. So, but you can get that pack off of her website. I've had patients say that really helped the motivation to do the whole abdominal castor oil pack, because it was more contained, less messy. Her packs have that soft wool on the inside, and then more like a plastic coating on the outside to help contain that castor oil there. And then the other key thing that can't believe I forgot to say is castor oil should always be dispensed in a glass bottle, because castor oil is a driving agent. So if you're using castor oil in a plastic bottle, you are using castor oil that has leached all the plastics from the bottle into the oil, and then now you're putting that on your skin. So really important to make sure that you're using a glass bottle for that. And you can also, if you want to throw in some essential oils, that can be, you'll only use a couple drops, because remember, essential oils are highly concentrated, highly therapeutic, but maybe just do 1 or 2 drops of lavender on there. Or the lemons and the citrus are really good for digestion, enhancing digestion. So you could do a couple of drops of orange onto your pack. So you can definitely get creative with it. We have used castor oil before for trying to derive agents into the skin. It's not good for eczema, because eczema, any inflammatory rash like that, is very hot. And if you put oil on it, it traps the heat there. You need more of the creams. But if you ever, we've used it to, if we need to derive something directly into the skin, it will help to drive it into the skin. It's that driving agent. So, I've never tried, that would be interesting. Now I'm thinking about this. Like if you sprain your ankle or below your knee, or strain a muscle, to maybe like rub some homeopathic traumeel on that area and do the castor oil pack over that to drive the homeopathics in. I've never tried that, but if someone wants to try it whenever, well, hopefully no one has to try it, but let me know how it goes. I've even had people do castor oil packs for the thyroid, for enlarged thyroids, and that works really well. You could just take like the eye mask, and Dr. Maricel sells one too. Saturate the castor oil, and the eye mask actually fits perfectly over your thyroid. So has a lot of uses. That's for sure.
Cool.
All right. Well, I don't have too much more to say about poop besides it's really interesting, and that it is, it's an indication of what's happening on the inside. So it is really important to watch. And if there's, the red flags to look out for, is the yellow stool, that malabsorption, which we've probably all seen at some point when we've had food poisoning or traveler's diarrhea. Let's say the yellow that persists, and that black tarry stool, because that indicates the bleed of the upper GI tract. So, and if your stool is sticky, you have to use a lot of toilet paper, then that means that there's a lot of inflammation in the intestines, and it's, we're passing that into the stool. So how much toilet paper, so think of everyone who went out and got all this toilet paper in COVID, they need to fix their stool, and they need to fix their intestines, because apparently they're hyper wipers. So gotta make a joke. So some exciting news. So I have lined up an immunologist to actually just talk with us about the COVID vaccine. Probably going to be end of December. I'm still waiting for her to pin down the date. She was my professor of immunology in medical school, so she's fantastic, and she already comes with a holistic bent, but she is definitely one of the brightest women that I know. And so I'll be very excited that she is going to talk to us about the COVID vaccine. So send me all of your questions ahead of time, or what topics or bullet points you think you're going to want to talk about, because I'm basically going to send her prompt questions about a week ahead of time. And so if there's anything in particular, burning questions that you want to ask now, let me know and I can make sure that they get included into the prompt questions. Just send them over to the info.co@nawellness.com. So that's Colorado's info email, basically. The email where all the Thrive messages come out of. All right. Well, we'll keep this one short and sweet, and I hope everyone has a wonderful weekend. Next week's talk is going to be a guest speaker, Dr. Sanaz Yamai. She is going to talk about how we internalize trauma in the body, so the stress of the trauma and the importance of that and the importance of addressing it. So it's going to be, I'm excited. It's going to be a very good talk. So, all right. Well, you guys have a wonderful weekend. Enjoy that sun.
You too.
Bye.